Back to our top story tonight. A South Valley hospital lays off hundreds of staff as they face what they say is a dire financial situation. Cahuilla Health now calling on the state for relief. Our Catherine Phillips joining us in studio. And Catherine, just how grim is the hospital's financial outlook?
Well, Stephanie, the CEO says out of all the counties statewide, Tulare County has the highest percentage of Medi-Cal patients, only worsening their financial issues. Now, he's asking for the governor for a one-time funding payment to help them make up for pandemic-related losses.
We have laid off more than 100 employees. We have closed more than 100 job openings.
After 2.5 years of the COVID-19 pandemic, Cahuilla Health CEO Gary Herbst says their hospital system is facing a, quote, dire situation as others are on the brink of financial collapse. Herbst says the added cost of treating COVID-19 patients, coupled with losses from suspending elective surgeries, has spelled disaster for Cahuilla Health. He says since the pandemic started, they've seen a total operating loss of $127 million. They've lost just $29 million during the first 3 months of this fiscal year. He also says when the pandemic started, they had 130 days of cash on hand. But now that number is down to just 84 days. He says now the financial strain isn't coming from COVID patients, but a lack of nurses working for the healthcare system.
We are literally experiencing an unprecedented over-reliance on very expensive contract staffing. We're paying 3 to 4 times more per hour than we would an employed nurse.
He says even with the travel nurses, regular contract nurses are having to do more work and getting steep overtime and bonuses. They've laid off hundreds of staff. However, none were bedside nurses, closed hundreds of job openings, paused raises, and are having executives and directors take substantial pay cuts. Visalia Mayor Steve Nelson says he supports Cahuilla Health's letter to the governor and is ready to echo their message.
Our healthcare network has been impacted. And if something's not done, that's not beneficial to the people they serve, which are the constituents I serve.
The CEO says in the wake of these issues, they've already had to close their skilled nursing unit and their neurosciences clinic. Live in the studio, Catherine Phillips, KC24, local news that matters.